It's basically just like you pay a subscription to have a pancreas.
Did that cause any loss of hope?
Just happened to find you, and I'm so blessed to have that. I had no idea what to do. It wasn't coming down, and I messaged you, and you just said, "Okay, here are the steps you need to take." And I did those steps, and it brought it back down. Standard college life things. You go to their
Hmm.
on-campus dining center, and you eat whatever they have on display, kind of thing. When you got diagnosed, it was just, well, can I do any of that now? It was this very confusing time in my life.
Hello, everyone. This is Dr. Chhaya Makhija, board certified endocrinologist and lifestyle medicine specialist. And today I bring you another great conversation that I'm excited about with Paul Stratton. I've known him for almost slightly more than a year and a half. We'll be crossing 2 years very soon. And I'm pretty sure his health journey is going to be inspiring to many of you out there. So I'm very, very delighted to introduce Paul and welcome to this conversation, which I've been thoroughly enjoying with many of our patients. So tell us something about Paul. Introduce yourself just the way you would want yourself to be known.
Yeah, sure. Hi, everyone. I'm Paul Stratton. I'm a type 1 diabetic. I met Dr. M just through kind of the internet. It was sheer luck, but I'll tell you, it was sort of a confusing process at first, and she's really sort of helped me sort things out. So,
Tell us something about you, Paul, like how life was prior to 2023.
so yeah, I got diagnosed a little over a year ago now, and it was a pretty good life. I mean, I'm just a college student. I'm in my fourth year now at the University of California, Merced, and standard college life things. You go to their
Hmm.
on-campus dining center and you eat whatever they have on display, kind of thing. And I did some pretty routine workouts and all that kind of stuff, just standard college life things that you'd be doing. And um, man, come the beginning of
Hmm.
2023, things had to kind of change dramatically. I mean, I didn't really know what I was doing because now, I had pictured my style of life before where, you eat
Hmm.
normally and you eat, a cookie every once in a while kind of thing. And, when you got diagnosed, it was just, well, can I do any of that now? It was this very confusing time in my life.
A setback for many of the individuals, especially when we talk about juvenile type 1 diabetes. Was there any specific symptom? Was there any specific hospitalization, or was it just a pretty much a quick diagnosis for you?
The way that it worked was a little bit different than I'm sure some other people have had it done in the past. I never really noticed any symptoms prior to having or getting diagnosed with type 1. Um, I mean, I told you earlier, really the only thing extra was maybe I went pee once more during the night kind of thing.
Mhm.
But, other than that, it was all very standard run-of-the-mill lifestyle. We sort of came across it by sheer luck. I went to my PCP when I moved to the college, and he just took a routine glucose check, which is not standard, but he just does it. That's something he does personally. And
Mhm.
my reading was completely off the charts. So, that sort of led into the whole, oh, okay, I guess it's time for the ER kind of thing. And
Mhm.
eventually, the diagnosis was type 1. And from there, it was, yeah, that whole confusing aspect of where do I go from here?
Did that cause uh, any loss of hope? Did that you have a great family support, so definitely that was helpful. But just in your mind, right? So, say the first time you're seeing the endocrinologist, you're trying to understand that. Okay, I just met with one doctor, which is my primary care, and I'm going to see another one.
It wasn't sunshine and rainbows when they told me that I had to
Mhm.
go to the
Of
emergency room,
course.
I'm sure. I don't know. I'm a very rational person, I think, when it comes to
Mhm.
health and all that kind of thing. So I know that it's not the end of the world. Um, it was just a matter of how do we deal with it, you know what I mean? And like you said, I have great family support when it comes to all this kind of stuff. We did a bunch of research together, searching up, endocrinologists online, and we just happened to find you, and I'm so blessed to have that. But when it came to the chaos of the whole thing, it wasn't a
Mhm.
matter of just settling into the chaos and sort of, sitting there dejectedly wondering what happens next, as much as it
Mhm.
was sorting through that chaos and sort of figuring out, okay, I need to deal with this illness now. How do I move forward?
And our mindset, how we perceive life, rather than just a condition or a disease, is so crucial, and that really helps us to get stronger, to face these challenges.
Before I was, going through this whole procedure and all that kind of thing, I was actually really afraid of needles. Um, I didn't like getting them at the doctor's office. I couldn't look at them or anything like that.
Hmm.
And obviously, I'm a little more used to them now, with the injections and everything. But it was nice to see that when I went to the emergency room, there were some really, really hospitable people there who sort of sat me down and walked me through the process of, hey, I know you're probably not in the best place right now, but here's some steps on how you can, mediate this illness and all that kind of stuff, and or not
Uh-huh.
mediate, but maybe mitigate or treat or whatever. I don't know. The transition was, it's hard to look back on it and say that it was difficult as much as it was, because again, very, rational. How do we deal with this kind of thing, right?
Hmm.
It was less, oh no, I have to do this, and more so like, I guess I have to do this now. Might as well get used to it, sort of thing.
Hmm. Hmm. Yeah, yeah. I remember the first time when we had to place the sensor, since you're telling me about the the needle. And do you want to share that experience?
Oh
Because
man,
now I
yeah, with
remember it
the
as you're talking about the needles and the
you're
injections.
talking about with the
The
yeah,
first
right.
sensor that I placed on you.
I remember it was not great because you have to push that button, right, in order to actually like poke you
Hmm.
and actually put the sensor in, and I was
Hmm.
not I was not into it by any means. Um, it took me a lot of very deep breaths and a lot of
Hmm.
focusing, but um,
Hmm.
it's funny to see how before it was, it took so long to just work myself up to doing that. And now it's just second nature almost of just sticking
Mm.
it on you and pressing the button and then you're done.
How is your experience with sensor placements now, whenever you place it?
It's really easy. It does.
Hmm.
So it will freak you out at first, probably. It takes a little bit of getting used to, but I mean, once you kind of know, oh, okay, it's going to hurt for a second and then it's going to stop hurting and then I don't need to do it again for, 10 or so days, you're you're good to go.
There were a lot of questions in your mind, especially the first few times that we met, right? Was there any specific moment or any specific milestone that was like, oh my gosh, this is such a great improvement. I feel like I'm in more control now.
The pump.
Okay.
Absolutely.
The
So
insulin pump, yes.
yeah, right. We switched from injections over to a tandem T-Slim pump, and it has been absolutely world changing. It's made it so that I don't have to, take injections every single day because I just have a way to give myself insulin at any given moment, and it has totally revolutionized the way that I live. Um,
Mm-hmm.
sure, it does have a battery life, and you need to plug it in when you take a shower. Sure, it does have to come off when you take a shower, even though, it's water resistant and all that kind of stuff. But the fact that I don't have to sit down at a dinner table and, stab myself before eating has completely changed my
Mm.
perception on this whole thing to the point where I almost don't even notice it anymore.
When we talk, when we are, or at least when you must have seen it for the first time, that, okay, what are these devices? It may get a little overwhelming that, oh my gosh, there are so many gadgets that are on my body 24/7, along with the tubing. But you brought up a very good point that you don't even come to know that it is a part of you. It's just one of the organ systems. Is that
It's
is that how you feel, or what is it?
it's like a pocket watch almost now.
Okay.
And with regards to the whole, complications and all that kind of thing, when I was first introduced to the pump, we had that training over at your office, and it was Nancy, right? That was
Mhm.
yeah. She was wonderful. She introduced me to all of the features of it, and I'm relatively tech savvy. I'm a computer science major over at the college, so I
Mhm.
know my way around a computer and all that kind of thing. But even if I didn't, the way that they explained it was so intuitive and simple, and it made it a really, really easy transition for me. And again, that transition was completely groundbreaking.
Tell us any few experiences, instances that you remember. Anything that's related to the text messaging that we've had, or phone calls that we had. Now it rings a bell. A few of those, like the initial, I would say the first 6 months,
Yeah, absolutely.
that helped you, either get more empowered or felt like, okay, I can deal with this obstacle too, or these yo-yos too with the blood sugars.
I mean, it's incredible that we live in an age where, you
Uh-huh.
are sitting in a classroom and something happens with your glucose and it's relatively new to you, so you don't really understand what's going on. And you can just send a text message to your endocrinologist and have her get back to you super fast. I remember
Mm.
in particular, I was sitting in one of my classes and I started to go a little bit low with my glucose. And I wasn't entirely sure, or no, it wasn't low, it was
This
high.
was
I
high.
apologize.
Mm.
Yeah. And I had no idea what to do. It wasn't coming down. I didn't know if I could give myself a correction bolus or anything like that. And I messaged you and you just said, okay, here are the steps you need to take. And I did those steps and it brought it back down.
Mm-hmm.
And when it started going back down, I remember in particular, there was this sense of relief where it wasn't just your normal, okay, cool, I have dealt with this high, I will be good to go. It wasn't just that, it was more. It was, okay, I have dealt with this high and it has come back down, and I can
Mm-hmm.
deal with these now in a way that I have a resource I can reach out to and I know that I will be okay.
That made me actually, found this practice that less patience, but can I be accessible? So that's very fulfilling for us as physicians, rather than just saying that, oh, we treated a condition or we prescribed this and then now A1C is good. There's another very key aspect about you that I really wanted to shine light on was the discipline in your schedule, which has really helped you, as well as I would say, even me as a physician, I've been very inspired by how the consistency that you maintain. Um, Tell us something about, how is your mindset, or uh, how do you start your day with, how do you end your day with, and what makes it fulfilling now with having the tools, having the resources, and having quite a lot of knowledge about the condition.
So I'm not a morning person really, and it
Mm-hmm.
takes a while for my brain to get going. And one thing that I've done to sort of standardize my morning and make things really easy for me is I make the exact same breakfast every single day. I take a piece of toast, I put some avocado on it, I put some eggs on it, and maybe some cheese or add some spinach or, something to add a little bit of flair to it if I'm feeling creative.
Yeah, just a
But
disclaimer, he sent me those pictures too. So I have
oh,
the
yeah,
record.
right.
I just saw the pictures. Yeah.
Yeah, right, exactly. But it's super easy for me because once I make that breakfast, I know exactly how many carbohydrates it is, so I can just log or how many,
Mhm.
non-fibrous carbohydrates or, whatever you do your net carbs. I know exactly how many that is. It's 25, so I can just pop that into my pump and wait a couple of minutes and start eating kind of thing. And while I'm waiting, I can, do the dishes or whatever, and
Mm.
by the time I'm ready to eat, I'm all good to go and I can start my morning every single day the same way, which for me
Mhm.
works. My perception on the whole rest of the day has sort of changed where before it was down to the every single carbohydrate matters kind of thing, where I have to look up how much an apple is and I need to weigh the apple on the scale and do all that kind of thing. And then based off of the grams, how many carbohydrates is this? And thanks to just sort of dealing with this for so long now, I have the ability to perceive how many carbohydrates this is. And, based off of whether I over or under compensate for how many carbs it is, I can just adjust from there, which has been a process that is learned. It's not something that I
Mm.
probably could have started with, but I mean, thanks to your help and just working with it for so long, it's been a lot easier to manage my glucose to, again, the point where it's almost second nature now. I'm not on any diet right now. I'm on a seafood diet in that I see food and I eat it. Um, but no, I think that was one of the things that really scared me when I was first starting out, especially with the manual injections and all that kind of thing, because I had no idea what my ratio was. I mean, that's probably the scariest part looking back on it, was I had no idea how many units of insulin I should inject per carbohydrate. And
Mhm.
it got to the point where I thought, oh, it's 1 to 1 even, where one carbohydrate was an entire unit of insulin. And obviously that's not the case now. I'm, 1 to 10 or 1 to 12 or 1 to 8 even sometimes. But
Mhm.
um, you can eat as many carbs as you want. You can have a normal diet with this. If I can guesstimate the carbs,
Correct. Yes, that's a great word.
then
Yes.
you can eat whatever you please still. It's still
Mhm.
within your wheelhouse.
Go
I
ahead.
always kick myself because my New Year's resolution for the end of 2022, right before I got diagnosed, was I'm going to start eating healthier. And come, February, I went, well, this is not what I meant, but at least it does give a perspective on what you eat.
Tell us one more thing about your workouts, exercise. How do you handle that duration with type 1 diabetes?
It was scary at first for sure because like I said, figuring all this stuff out at the start was sort of chaotic and running through the chaos obviously takes some time. And one thing that got picked up later was exercise. Like I said before I was diagnosed, I did regular workouts, but I was very afraid of going low when I started. So I sort of put them on hold while I figured out my ratio and everything else in that sense. And once I started reintroducing it, I found that it totally works. It fits in my life still. So nowadays it really just feels like a normal workout. I'm back to doing my regularly scheduled maintenance of my body kind of thing. And
Mhm.
the only thing that I really have to pay attention to is it will lower your glucose. It does lower your blood sugars typically. So one thing that I have done is on my pump especially, you can set a temporary basal rate, which
Mhm.
we've talked to death about, and by lowering that, it sort of compensates for the fact that you're going to have lower glucose.
Has there been an impact on your emotional, psychological, or even physical well-being? Uh, in a better way, in a negative way? Where do you see your future? How do you envision your future?
Well, it's basically just like you pay a subscription to have a pancreas now. That's about it. Um, in terms of perception on life emotionally, I feel the exact same pre-diagnosis now. Uh,
Mhm.
Again, it's really just a background aspect of my life that I need to deal with. But, my perception of myself socially hasn't changed either. I feel just as comfortable socially as I did before. It just,
Mm.
sometimes you get, one or two weird looks if you're eating out in public and you pull out this device and you're typing something in. But, it's really run of the mill. Like people understand.
So thank you for sharing this discussion. I'm pretty sure several individuals, and I feel thousands of them, will be inspired, be it type 1 diabetes, be it type 2 diabetes, be it any condition. Because the way you said it's second nature, you tackle it, you deal with it, but not let this get affected. And with the right resources, with the right knowledge as well as expertise. So thank you so much for joining, and I look forward to you seeing inventing something for type 1 diabetes in the future. Who knows?
Yeah, that's the hope, right?
Yes, absolutely. Absolutely. Thank you so much, Paul.
Yeah, of course.